Welcome back to the Caregiver Relief Podcast. This episode is sponsored by myvitalvault.net, your all-in-one life organizer for aging adults and caregivers. It's designed to help you securely store your essential legal, medical, and emergency information in one easy-to-access place. Because when a crisis hits, being prepared can make all the difference. Join our Caregiver Relief community, a warm, welcoming space where you can connect with other caregivers, ask questions, share stories, and find support from people who truly understand. Visit community.caregiverrelief.com to join now, because caregiving is one of the hardest and most meaningful things you'll ever do, and no one should have to do it alone. And if this episode speaks to you, please take a moment to like, share, or comment. Every click helps us reach more caregivers who need encouragement, resources, and hope. Today's topic is the right equipment right now, a caregiver's guide to DME and assistive devices. I'm Diane Carbo, RN, and I'm here with my co-host and regular contributor, Tara Slaughter. She is a certified durable medical equipment specialist and founder of CFS Medical Supplies and CFS Solutions DBS. Today, we're talking about something that might not seem like a big deal until it becomes one: seat cushions. Whether you're caring for someone who uses a wheelchair part-time, full-time, or just sits for long periods, the right cushion can make the right difference between comfort and complications, even hospitalizations due to pressure injuries. We'll talk about the different types of cushions, how to choose the right one for your loved one's unique body and condition, and why so many caregivers make the mistake of choosing the cheapest option only to regret it later. We'll talk about what you should ask your doctor or DME provider before accepting any cushion. Remember, insurance doesn't always cover what's best, and not all cushions are created equal. And as always, you can reach out with questions through our Ask the Expert section at caregiverrelief.com, or connect with Tara directly for personalized equipment consultations. And we'll have both a link to her site and in the show notes and on this page where you can find this in the podcast. So let's dive in. Tara, I know you're really busy. It's a busy time of year. Let's get started with the basics. Why is a seat cushion so important as a piece of durable medical equipment?
Hello, Diane, and I love what we do. So we're back.
Me too.
Yes. Oh my gosh. When it comes to the seat cushions, it's so critical to choose the right one. And I know that you're probably thinking, how do we choose the right one? A lot of times that goes back to the fact of reaching out to a durable medical equipment company, one that can actually analyze your situation depending on what you have going on with you, what your diagnoses are, what you're doing daily. Are you sitting in chairs for long periods of time? And based on what's going on with you health-wise too, right? In order to choose the right one to make sure it's not going to hurt you or harm you. I know a lot of times, I'm sorry, go ahead, Diane.
No, I was just going to say, as an old ortho rehab nurse, I can't tell people enough how important the right cushion is. And so I'm really glad you're bringing this topic to our attention, because while it seems like a minute topic, it's massive for comfort and really important to prevent other injuries.
Yeah, it is. And the thing of it is too, is that what we find that a lot of times, because with the insurance and everything, they'll pay for a basic seat cushion, which is fine. But unfortunately, people still tend to get sores on their buttock
Yes.
area. And so you have to
Yes.
wonder, why is that when they're either using a cushion, but are they using the right cushion? You have cushions, you want to make sure you get one within the weight capacity. Is it fitting the chair properly? Every chair, every seat, just because it's a seat cushion doesn't mean that it will be conducive to the particular chair that you may have. There's all type of cushions out here, redistribution, you got your row holds. The list goes on and on. And it really pains me when I see patients using maybe something that looks like a seat, like a pillow. That is so, oh my God, that's so unfortunate. But unfortunately, people do tend to just have, oh, like, it's just a seat cushion. Oh, they're just sitting on it. And you're taking care of your loved one, and they'll just throw pillows in the chairs. And
Yes.
fortunately, that causes a problem in the long run. And
There's so
so,
many. Oh,
oh no, go
sorry.
ahead. Go ahead.
There's so many different types. There's foam, gel, air, hybrid
Exactly.
cushions, and they all differ in terms of function and support. Where do you start?
You start by first having a clinical assessment done.
Okay.
So that meaning the DME company or provider who specializes, or they may not specialize, but they know what questions to ask you when you
Mm.
do an assessment to make sure that you're going to get the proper one. You know, what's going, like we just mentioned, what is your condition like? Are you sitting in a long period of time? What's going on? Do you have diabetes? Do you have what all these, do you have current wounds currently right now? All these questions are to be asked. And then that way I help you narrow down the particular proper type of seat cushion that you should be choosing. Like just an example, I'll give you an example. We often hear this, but wheelchair users,
Mm.
33% develop pressure ulcers using seating support.
Yep.
Okay. And so think about that. And that's a study that anyone can go to on US National Library of Medicine and
Yep.
to get those statistics, right? And so when we talk about seat cushioning, seat surfaces, that's what you want to do. You want to make sure you talk to your doctor. You may have if you have a wound already, talk to the wound nurse. When you talk about complex rehab, even then going into that, communicating with maybe an ATP too,
Yeah.
to as an evaluation to make sure that you're getting, you may not have to get a particular chair, but just making sure that you have the right seat cushion. I know a lot of times the doctors and nurses recommend, and I know you would agree to this, the Roho. The Roho
Yes.
cushions are amazing. And, but of course, sometimes the insurance may pay for them, but they may not. And they're not, to be honest, for what they do, they're not really that expensive when you think about the
Yes.
outcome of your health and what
Yes.
you're sitting, what it's going to produce for you.
The Roho cushions have been around for forever. And I wanted to make another point there. I know while you're talking about conditions, but if you're a person that's incontinent a lot, even that makes a difference into the type
Mhm.
of cushion that you have. And I get really concerned because I have clients that have been having had strokes, and they're in a wheelchair like 20 out of they shouldn't be, but they sit up all day long, or quadriplegics or paraplegics, and or those with Parkinson's. There's so many things. I'd like to talk about who really needs a specialized cushion, and is this just for long-term wheelchair users, or short part-time users, or seniors are also to be concerned?
I would say yes to that, Diane, and I'll tell you why. Because honestly, it's just us. We may not have anything going on with us, but the
Mhm.
fact that we're sitting all day, an example, whereas you don't have to be a senior or older person. For myself, I sit on a seat cushion right now. I sit on a seat cushion and a
Me
back
too.
cushion every single day. And it's
Yep.
because over the years, I've learned that I had sciatic for one thing. So it
Yep.
pushed me in that area, right?
Yep.
But even after the sciatic has subsided, I don't have that issue a lot. And it just depends on, of course, how I'm moving. But what I find that I have to sit on one. I sit on one at my office. I
Yeah.
have one at home. I do not sit in a chair.
Yeah.
Of course, you know, you can't take the seat cushion all over the place with you.
Yeah.
Anytime I'm sitting somewhere, I know I'm going to be sitting for a long period of time. I have a cushion, a back cushion, and a seat cushion
I do
for that
too,
purpose.
because I have a bad back and I don't have a lot of padding on my behinder. So I get very uncomfortable. And I also have a bad back from all the lifting over the years, and have had suffered from sciatica. It's not just for people it's just a practical application to use to decrease pain and maybe further injuring yourself. Because when we're sitting all day long, we're not comfortable.
Exactly. And then you wonder why when you're sitting, you talk about, look, we talk about wounds, right? But let's talk about the lower back.
Yes.
Let's talk about the spine, the lower back area. My goodness, if you're sitting for a long period of time, you notice how you start to, you feel like your hips are burning and you're like, oh my God, why I'm sitting. You get up and you move, right?
Yep.
Because what you're sitting on, it does not redistribute. And it actually, so you're just sitting there and all of a sudden you're having all these pains. And we wonder why we having all this lower back pain. And
Yep.
so a lot of that has to do with what we're sitting on.
Yep.
And
I
so it's
use
so
one in my
important.
car even, especially for long rides.
Yes,
Yeah.
exactly,
Yeah.
exactly. Right. And so I think they should be used. And I'll just throw out some more of those studies here, and then people can definitely go and check it out and stuff. But there's some comparison when you talked about the foam and the gel and the air cushions, found that air cell designs often provide better pressure relief and shear reduction. Okay, which is vital for skin integrity. So just know that out there. Okay. And then, so basically, in that, they did a pilot study that showed cushions that have the people who use seat cushions, the proper seat cushions, have less skin breakdown.
And I want to explain what shearing is. Shearing is when you pull your skin's being pulled and
Mhm.
stretched. And over long periods of time, what happens is that if you're putting weight on that, the circulation isn't getting to that area and it starts to, the oxygen is not getting, the blood system is not getting to the cells of the skin tissue and it starts to break down. And that's exactly what a pressure sore is. It develops a pressure sore. And one of the things I really encourage everybody is when you're doing good care, you need lotion on your bottom. You need your lotion on the backs of on your legs. And people don't do that, but it's really important, especially if you're going to be in a sitting position, especially if you're using a wheelchair for long periods of time, you really need to make sure you put moisturizer on your behind so that your bottom, so that you can, those are medical terms I want you to know. So that, you and don't use powder. Do not use powder. People want to do that because that absorbs or moisture and causes more breakdown. So now, can you tell me the risk of using a low cost or generic cushion, especially when selected without professional guidance?
Again, it goes back to what you just mentioned. You're going to have that breakdown of the skin because
Yep.
every cushion is not conducive to the chair. That's why you want to make sure that you speak to a professional so they can analyze what you're sitting on, what you're using the seat cushion for, what is your weight capacity, making sure that you get the proper one. Are there any sliding? Are you sliding out of the chair? All those things that will be considered. So basically, the whole thing is difficult to say, oh, get this particular one over this particular one. It all goes back to having a clinical assessment done first. Speaking
Yes.
to a professional to make sure that you explain to them what's going on with you. And then I'll say this to Diane. I know a lot of times like we don't know what questions, sometimes patients they don't know what questions to ask. So
Yes.
if you reach to a certain provider and they aren't asking you certain questions, feel free to reach out to us and say, hey, like what questions should we be asking someone when we're trying to narrow down a particular seat cushion that we should be using. And then that way you can narrow things down. And I do that for all of our products, not just for seat cushions, but I recommend that for all of the products that we provide or we give information about. Speaking
Yeah.
to someone on the clinical side, and because you never know, and it goes back to just an example. You can talk to someone who's selling a product to you. As an example, say someone's selling you the seat cushion. They're just giving you the specs on what the seat cushion does.
Yes.
Spec, that's all fine, but that doesn't help you on the clinical side, if that makes
Exactly.
sense. So you can
Exactly.
tell me,
Yes.
oh, the seat cushion redistributes. It helps with the cell. It helps with my lower back. It helps all those things. Guess what? That particular, it does all those great things, but is it right for you? And that's the question that you have to ask yourself. And that's when it goes back to speaking to someone who specializes in understanding what type of seat cushion you should be getting based on your clinical need. Everybody clinical needs are different. What
Yes.
works for one person may not work for you. What me, like I may be sitting on a cushion that may not work for you and vice versa. So that's why it's always critical that you do a clinical assessment and narrow down the specifics of the type of cushion that you would be needing for yourself or your loved one.
And again, you have to consider what your future needs are going to be.
Yes.
And if it's going to be a permanent condition where you're unable to move to get that repositioning and stuff, you really have to think long term and you want a good quality cushion to last for a longer period of time. So,
Exactly.
can you
Exactly.
give me an idea of some conditions or risk factors that should prompt the caregiver or healthcare provider to choose a pressure relieving cushion?
I would say diabetes would be
Yep.
one. Yeah, so being a diabetic can cause a lot of different things like that. So I would say if you have a lower back problems like that, not so much, maybe possibly, because I'm not a nurse. So let me just put
Yeah.
that out there right quick.
Yeah. Oh,
But
I'll put my 2 cents worth in.
yeah, you do that, Diane. But I would definitely say if you have diabetes, that is one of the major things that you want to, because you're sitting,
Yes.
circulation going on. So
Yes.
that is definitely what I would say, that you definitely want to make sure
And
to
diabetics also have neuropathy.
yeah.
And when they have that, they don't always have good feeling.
Mhm.
That's really important that they have a good seat cushion. And I know people think, oh, when they think of somebody like a quadriplegic or a paraplegic or somebody who's on long-term condition after a stroke, but there's so many other conditions out there, people with Parkinson's or
Yeah.
any neurodegenerative disease. I know for me, I have chronic pain. My years of I tease that I picked up men for a living because in essence I really did. I was a rehab nurse, and in those days we didn't have the access to equipment to the degree they do now. We were taught to do a fireman's lift and people and transfer quads and paras and stroke victims to another chair. And we had my back right now. I can never get comfortable. And that's why I need a seat cushion and a back cushion to help
Mhm.
me for day, especially for days like this when I'm doing podcasts and
Right.
I want to be comfortable, because I can tell you right now, my sitter hurts when I don't use a cushion.
Yes, I mean, you find yourself moving from one side to
Yep,
another.
yep,
Right,
yep.
so when you're trying to get comfortable, that part doesn't work. Oh my God, let me move over here. And it's just unbelievable. So that's why it's so critical that you have the right and the proper seat cushion. And
Yes.
so I'll throw out some journals that people out there can go and do their own research too, if they want to just get more in depth and find out, get the information. The Scryer Project Spinal Cord Injury Rehab Evidence is one that they can look into. And then Cambridge Media Journals for wound practice and research is good. They did a lot of peer reviews and things of that nature on the importance of choosing the proper seat cushion.
Can you give me some signs that a current cushion is not meeting the needs of the person using it, whether it's too soft, too firm, or poorly fitted?
All three, all three of the above. So I would say, again, and that's tough, Diane, because it goes back to, if I say, oh, this
Reddened areas.
if the, I'm sorry, Diane, what did you
I
say?
said they see red. You see reddened areas on their bottoms and their legs.
Exactly. And it goes back to assessing the patient, understanding what's going on with the patient, because they're using a firm one. They may need something a little softer. You don't know that until you actually do a clinical assessment and or talk to a nurse or
Yeah,
the doctor or whomever or the caregiver who's assessing the patient. That's
yeah.
another thing. So if you have a patient you're taking care of and they may be using a cushion, understand the type of cushion that they're using, right? So if you're using, you have your loved one, or if it's a resident and they're using a certain type of cushion, and you want to know, make sure you know what the model of that seat cushion is, because you may find like that. Oh, now they do have some redness going on. This isn't working. Why isn't it working? And then that's when you to make the decision to say, okay, maybe we need to get this assessed to find out what other type of cushion that we can get this patient to be using based on what's going on with them. What used to work may not work in a few months.
Exactly,
Yeah.
exactly. And I want my listeners to know, if you're taking care of somebody who is using a seat cushion and you're providing care for them, you have to look at their skin all the time. You need to be looking at their back, their bottom, and their heels. I know we're not talking about heels today, but you really need to have all those things assessed on a regular basis, several times a day. And normal nursing practice is to readjust and reposition somebody every 2 hours when they're not able to move. And I know that people say, oh my gosh, but that's where a good seat cushion comes in, along with the right wheelchair where you can readjust easily. And that's
Exactly.
really important.
And I'll say this too. I know one of our last episodes, we talked about wheelchairs and how critical it is to make sure you have the proper wheelchair, depending on how you're sitting and the long time. If you're sitting in it more than 2 hours,
Yep.
making sure you have something that gives you what they call tilt and recline
Yes.
position, chair, not just a regular chair, because a wheelchair is not intended for you to sit in it all day long. It's you're sitting up vertical, and that's just not healthy. And so the thing of it is too, you can have a proper seat cushion and you have a chair that might not be conducive,
Yep.
then it defeats what you're trying to accomplish because you
Yeah.
don't have the proper chair.
Exactly. And that's why I think it's really important that people put the two together and know that. Now, there are cushions that, like for me, there are times when I have patients that have problems with chronic incontinence and they have excoriated red sore behinds, not because of been sitting, but because of the urine. And what I do is I always make sure that they also have a proper cushion, even to sit on the couch. People don't
Exactly.
understand that. You want something that's going to provide not only support, but help keep the pressure off some of the, so that it doesn't break down and become a total a decubitus or pressure sore. And that's really
Right.
important as
Right.
well.
And the thing of it is too, Diane, goes back when you're talking about the incontinence problem and the seat cushion, it goes back to when you have the proper product, then you shouldn't have that type of leakage going on either.
Yeah. Yeah. And
And
we'll
so
talk about that on
that's
another.
yeah, we'll talk about that because
Yeah.
when you think about that, you can have a right seat cushion,
Yeah.
you can have the right chair, but
Yeah.
if you have on something, it's all that coincide together.
Yep.
For the proper incontinence products,
Yeah.
proper cushion, proper
Yeah.
chair. Those three things, because if you got one missing, it could
Yeah.
defeat the other things. And what the goal is to accomplish that. And I would definitely say to make sure that all those things are covered. And we'll talk about that on the next one because
Yeah.
that is so important to
It
make sure
absolutely
that
is.
the breakdown of the skin, I don't care if you do have a good cushion. If you have something on that's still, yeah, that is a whole different topic, but it's very important. So,
Now, people also don't understand that body weight, skin integrity, posture, and even temperature sensitivity affects cushion selection.
it is, it
It
does.
all does. And if you have a big person that is losing weight or gaining weight, that means there's different things you have to take into account.
Exactly. It goes back to getting an assessment. And guess what? Sometimes it does. You need to do one every 6 months
Yes.
to
Yes.
check to make sure, yeah, how's it going? If they're still using the same cushion, do they need to change to something else? And I don't know if you guys, if you know this, but they actually have a seat cushion that's an alternating pressure pad.
I have seen them. I have seen them.
Yes.
Yes.
Families
Yes.
that get those, and they have been a game changer for their loved one because it's redistributing
Yeah.
air as like an alternating pressure pad would if it was on your bed. So it's in your
I
chair.
want you to know 40 years ago, I had them do a test on that type, the air,
Uh-huh.
alternating air pads. And fascinating because we did tests on our patients that was in Paris and stroke victims and stroke survivors. And it took a lot of work and they must have gone through 50 different prototypes till they found something that worked.
Yeah. And that's the thing too. And I think that's a challenging part of it too when we talk about seat cushions and seat surfaces because sometimes you may have to choose a few different ones to order to get it right. It's
Yeah.
not one size fits all. It's just
Nope.
just not. And so that's where just being alert, evaluating the situation every 3 to 6 months, making sure that you know what's going on with the skin integrity and things of that nature. And that would allow you to be able to hopefully choose the proper seating that way.
Yeah.
Because I've had people to purchase the one that we thought was the right one
Yeah.
clinically or something could change in the body, all these different things.
Yeah.
It's not one of those things where you could say, oh, yeah, this is it right here. You have to play with it sometimes just to make sure you get it right.
Because people are different and they
Yeah.
respond different to different
Yeah.
things. So what works for somebody who, like somebody who has a larger buttocks may have absolutely need something different from like me, who there's nothing behind there. I'm just flat. And here I am talking like I don't care. It's just those are things that you have to consider. And it's very uncomfortable to talk about it. As a nurse, I don't care. You just need to address it and say, let's look at these things. And you have to consider too the muscle of the person, the muscular nature of the person, because they may start out, they're just newly injured And over time, they're going to decrease in their ability, their strength and their muscles because they're not using them anymore. And
Right,
that plays
right.
another part.
It does.
Now, I want to talk about, are there certain features, cushion features, that caregivers should prioritize, like waterproof covers or easy cleaning or contouring? What is important, especially for home use?
Yes, I would say, yeah, definitely waterproof because it goes back to what we talk about incontinence, right? So you
Yeah.
want to make sure that you get one that may be waterproof, right? Or have a covering that can be washed. Those are things to look at into. It goes back to the weight capacity of the patient, right? So
Yeah.
when you start making those choices, it goes back to getting that clinical assessment, understanding what's going on with the patient before you can continence. You want something that you can wipe off, clean,
Yeah.
depending on what the cushion is doing. So all those things to be in consider. So it's again, it goes back. It's tough to be like, okay, get this one, get that one, because everyone is totally different. With the foam
Yeah.
may not work, the gel may it just depends on. You may get one that has gel and foam in it together. That may be
Yeah.
suffice. Sometimes people just need just a foam. Some people need the donut. And it goes back to what's going on with the person. The coxie, all that, the coxie opening, the closing. There's so many different options out there
Yeah.
that we look at to make sure that you're going to get the right one.
Now, the big thing that everybody does is they want to shop online. So they want to buy online. Well, how do we help people that to avoid buying the wrong type without an in-person fitting? I'm
Oh,
just going to say right ahead, don't do it. But people, they're going to say, you know what, you don't know what you're talking about. And I just need convenience for me right now. And it doesn't work that way. But people are going to do what they want to do. Is there anything that we can tell them to avoid buying the wrong type?
it goes back again to speak to a specialist or someone who specializes in medical equipment who can kind of, I'll tell you what, if you go online and because how do you even know? You can read through
Yeah.
what the specs are to see, okay, this seems like it may work for me. But if you're going to go it alone, at least take your health in consideration as far as knowing, okay, I have this going on with me. I have
Yes.
that going on with me. So because I have these things going on, see what the specs say about that. So if you're going
Yes.
on there and you looking like this particular cushion does A, B, C, D, right? If
Mhm.
you look at that and you say, oh, well, you know what you have going on or your loved one has going on clinically, then
Yeah.
you may be able to narrow it down. If you want to avoid talking to a specialist, you
Yeah.
can do something like that. I can't guarantee you it's going to work
Yeah.
because sometimes we dig a little bit deeper on question asking, and we do that based on the fact that we deal with so many different people and so many different cases. If that it's like
Yeah.
you being a nurse, right?
Yeah. Oh, yeah.
So many different scenarios and examples that just because you can go and read something, but it doesn't mean that it's gonna work, right?
Yeah.
So I just give you an example. I had a client a couple of weeks ago when we did an assessment on it was for a positioning chair, a special positioning chair. The measurements were perfect, Diane. Like everything with
Uh-huh.
the perfect, the measurements, right?
Yeah.
But in order for that patient to remain doing what they do daily,
Uh-huh.
what they love doing, so you don't take what they love doing daily away from them,
No,
we
no.
manipulate the measurements.
Yeah.
My point to that is you can't read that online.
Exactly.
Does that make
Exactly.
sense?
Yeah. Yeah.
My point to that is that we dig a little bit deeper and I had to sit back and think, now this measurements are great. This will work really good, but he's gonna lose something. He's
Yeah.
gonna lose what he does daily, and we don't want to take that from him. We
Yeah.
want him to
Yeah.
still remain active, doing his daily activities, but you can't read that.
Yeah. And
That's
you want them to be happy and
exactly.
healthy and safe.
Exactly. All of
Yeah.
the above. So
Yeah.
how can I make you safe, happy, and still allow you to do the things that you want and need to do daily to keep going? So
Yes. Yes.
those are things that you can't read about. You can read about it, but you know what I'm saying? So basically my point to that is that when you're looking at gauging these things, we take experiences of different scenarios that we have and we
Yes.
say, oh, I remember I had a client and this was going on. Let me see if that might work for this particular client.
Uh-huh.
Right?
Yeah.
Those are the type of things that we do. And you can't get that just by looking at a spec.
I have to tell you, that's one thing. I know I can walk into a place and I know that person's sitting in the wrong chair, that walker is not the right walker, their crutches were never fitted. I
Oh,
know you can't teach that to somebody. That's why our experience is so valuable, because over time you just get a feel for what's right, for what isn't right, and
yeah,
what has worked for others that may work for this specific client. And that
exactly.
comes with experience.
It does. It really does. And that is so true because you see things you're like, no. Yeah. I had did just a quick tip yesterday, and it was just basically I had a client that came in yesterday. Unfortunately, he got a walker from the insurance and it was just drop shipped to him, and it didn't work out for him. First of all, he couldn't fit it through his doorways. That was one problem. And then it just wasn't conducive to him because he was a little bit of a taller guy and he was too short. And so basically my tip was understanding you as a consumer or a patient, knowing what questions to ask. So
Yes.
listening to these type of calls and podcast interviews are really good because it allows you to advocate for yourself so that you know just as much as the next person who may, you can put your heads together. Because I always say these things to me is solving a puzzle.
Yes.
How do we solve the solution of what someone's going through? Because everything is different. Everybody has a different situation, and it requires sometimes, especially a team, to sit down and be like, let's figure this out for Mr. Jones, right? And
Yes.
yeah, so those are things that I definitely will hone in on. And so the tip on that is talk to someone who can probably help you navigate what you're going through to make sure you pick the right products. Especially the seat cushion.
Talk long term. How often should a cushion be replaced? And what should caregivers know about cushion maintenance and wear and tear?
Ooh, okay, that's a good one right there. So I would say, first of all, every 6 months, I would say anywhere from 3 to 6 months, check the cushion. See how
Okay.
it's flattened out, right? You turn it over, what things like that. Making sure you keep them clean. If it has a cover on it, take it off and wash it. Making
Yeah.
sure that is good too, because you don't want to be using something that's has bacteria on it, soil, things of that nature. We see that, unfortunately.
See it all the time.
And I'll tell you too, just because it has a seat cover on it, Diane, make sure to use, if you know you have someone that does leak, make sure you have a underpad on that that you
Yes.
can dispose of too. Those are
Yes.
things that I would say to look out for too, that you can do. Put that underpad on there. They come in different sizes. So have that on there, even though it does have a covering on it. Keep it washed. Do that. And I'm talking about ones that, not the ones that, because some of them are, if they have a mechanical, I'm talking about the alternating pressure pad, you can't just
Yeah.
wash that. However, if you have it a little cover over it, you
Yeah.
can definitely wash that. So those are things that I will look at.
Exactly.
Yeah. So every 3 to 6 months, I would definitely check it, check the
Mhm.
integrity of the skin, as we talked about, for the patient.
Yeah.
And of course, making sure that it's not flattened out. I've purchased some too that I've set on and I'm like, this thing.
It's like a mattress. You're supposed to
Yeah,
turn your mattress over so many months, because
exactly.
you get that divot where you were laying, and you got to get it worn. So you got to move it so it's comfortable again.
And I would say exchange it out. If I'm honestly, if you can, I would say get two so you can exchange it out, right? So it's
Yes.
still remaining that the 3 inches, 2 inches, or whatever that is that's comfortable for the yourself or the loved one. You want
Uh-huh.
to do that. Hopefully, they're not too expensive, depending on which one they recommended for you.
The thing is, if you can get to and rotate them every other day, that's really nice to be able to do too,
Mhm.
because then you're increasing the amount of time that they're going to work, you would hope. So now, if someone isn't sure what kind of cushion is right for them or their loved one, how can a consultation with a DME specialist like you help prevent costly or harmful mistakes?
Because we would ask them questions about what's going on with them clinically, what they're using right now, what type of chair they're sitting in right now, and what are their daily activities and things of that nature. So how that helps them, because we narrow down what's going on, and then we're able to select one that hopefully would be beneficial to them. So what does that do? It's going to save you time, going to save you money, because now you're not just buying anything. You know what you're going to be getting, and then you go from there.
Yeah. Tara,
So
thank you so much. I know you're swamped. It's really busy. One of the problems that you have is because you provide such good customer service, people come back to you often. And that's good because that's why we're doing what we're doing. We want people to know what's the right way to approach. So, how do they reach out to you?
They can reach us at 310-817-5373, or they can go on our website at www.cfsmedicalequipment.com. And I have to tell you, Diane, because we have gotten so busy, that what we've done is we're trying to create what we do. We created video modules to help people explain in detailed
Yes.
on some of the things that you don't see just reading stuff, that you can based on our experience and stuff, that we're putting in video modules, so that way that people can actually go and as a membership too, where they can actually go and get access to things about insurance, what new products are out, what's going on in the healthcare market, all these different things dealing with what we deal with on a daily basis, in a section of where they can kind of go and listen, read, and all that stuff, and stay abreast on what's going on in this healthcare journey.
I will have all that information at the bottom of our page and in the show notes. And I also want to thank you for your time today because you're a blessing and going to help change the world one seat cushion at a time.
And let me tell you guys, Diane is amazing. Oh my gosh, like I had clients that I called Diane and say, Diane, because I am not a nurse. Okay, so let's just make that out there. But I called Diane and asked her questions to help assist people. And so we don't just serve as a company that sell medical products. We love to do consulting, resources, and can we look at ourselves as a healthcare community where we put people together or we ask questions. I don't know everything, Diane. We don't all pretend to know everything because we don't. So every case is different, but what we do is we try to connect people with people to try to see how life can be just a little bit easier for this caregiver journey. And so even down to, I recommended like the app that Giancarlo has, Dan. Oh my gosh.
Watch Our Own. The Giancarlo app is amazing. Yeah, it's Watch Our Own.
Watch Our Own. Yeah. So those things are amazing that people should definitely look out for. Just going and listening to Dan Cohen's interview on dementia and how music changed.
Yes.
All those things are so critical. People need that.
Yes. And that's why we're doing this. I'm a old rehab nurse. I have had lots of experience in different arenas in nursing after 54 years, but I don't know the intricacies of equipment, assistive devices, whereas that's your specialty. And I know just enough to tell people you need to call Tara.
Yeah. Oh my gosh. And
Yeah.
you know what? And we learn every day. So that's
Yes.
what it's too. Like I tell people, like I don't know everything, but we know enough to help you get move in the right direction.
In the right
we're learning
direction.
every day also, because there's new products popping up all the time.
Exactly.
So with that said, thank you guys for having us on today. Thank you, Diane, for having me. And I'm looking forward to our next topic.
Me too. To my family caregivers out there, you are the most important part of the caregiving equation. Without you, it all falls apart. So please practice self-care every day. Learn to be gentle with yourself because you are worth it.